Hey fam, I'm doing this a video mainly for family or whoever else wants to watch. I want to explain why it's important that we need to be doing social distancing, and why if you know me or you're related to me, and if you've been taking this lightly, why you I mean quite honestly, you should be shocked and appalled at yourself if you're not doing this. I'll explain using simple math and graphs, hopefully, um, to explain to you why, if you have not been harshly practicing social distancing, at least since the mandate, the 13th, why it's very important. All right, so let's start with this graph right here. Okay, the blue is the total cases right here. So just take a look at this blue right here. Guys, let's talk about the incubation period. Okay, so this is a lot. We're over 2,000 a day in Georgia. Okay, let me let's be clear. Okay, the incubation period could be 2 weeks. It could be 3 or 4 weeks before you even have symptoms. All 2,000 of these people had no idea they were sick 2 weeks ago, 3 weeks ago. All right, it was down here. Okay, now another statistic, very important. Go to the CDC or Georgia Department of Health website. Hospitalized, 28%. Let's make it easy numbers, 25%. What's 25% of 2,000? 25% of 2,000 is roughly 500. That's 500 extra hospital beds. Now you might say, that's fine. Georgia's got 500 extra hospital beds. Well, this is an exponential curve, guys. In 2 or 3 days, this is going to be 4,000. In 2 or 3 more, it's going to be, it's the rule of 72. Basically, this thing has about a 16% growth rate in most cities. Rule of 72, 72 divided by 16, that means it doubles every 5 or 6 days. So let's remember that. This is going to double every 5 or 6 days. This is simple math, doubling. Let's look by county. Fulton County is the tallest, the biggest right now. It's over 300. That's an easy number to work with. 25% of 300 is 75. Does Fulton County have extra 75 hospital beds? Maybe. But in 3 or 4 days, 8 days, 12 days, it's going to double 3 times. That is if folks like us are not practicing social distancing. Okay, 3 times. So that's 150, and then 300, and then 600. Does Fulton County have an extra 600 hospital beds? I'm willing to bet they might not. And this is going to continue to go exponential, guys, because Fulton County's got a lot of people. All right, 300, doubling, it doubles to 600, doubles to 1,200, doubles to 2,400 people sick in Fulton County. Are there 2,400 people in Fulton County? Yeah, there's a heck ton more than that, guys. Okay, so it could get this far. Now, what we want to do is get to the leveling off point. What does that look like? Well, yesterday, this is what it looked like. Fulton County was actually looking pretty good yesterday. I mean, the logistical curve right here was really trending down, okay? But let's see what it's doing today, okay? Let's add the extra information in here today, March 27th, and now it's at what? 307. Whoa. Today's data just made the prediction grow by about, 500-600 people, okay? And I guarantee you it's going to keep growing if people don't practice social distancing. All right, now let me show you a scary example. Dougherty County. Okay, this was yesterday. All right, they're not even close. Like even with Fulton County's bad, they got 100 more cases, like 90 more cases today. Even with that bad news, for Fulton County. Dougherty is still way over them. Okay, let's add the information in for Dougherty today. Wait, I think I might get my number wrong for, let's see, 193. I got my number wrong somehow. It doesn't matter as long as it's going up by ones. 193. Okay. Or was that Fulton? Okay. Oh yeah, that was Fulton. My bad. Let's see, 27, 156. No, 28, 193. So that's actually a little bit better because they jumped really high on the 26th. And now they only increased by 40. But then again, guys, was 25% of 40. So today, guys, today, they have 40 extra patients. That's 10 extra hospital beds. Did they have 10 extra hospital beds today? That's the thing, guys. And when you start talking about like people at New York City, here you go, where they're dying outside because they're waiting on hospital beds. You talk about a bad day. And I'm talking about people being very irresponsible and, starting to do some bad things. So with that said, what we want to do, this curve, they want to flatten the curve. This is a logistical curve, guys. It goes exponential and then logistic. It's got to get real bad before it gets better. But if people don't practice social distancing, guys, look what this curve ends. This curve ends right about 900, okay? That's best case scenario. That's if we don't continue going exponential. All right. So what was this? This was for Dougherty County. So let's estimate it at 1,000. That's easy math. 25% of 1,000. Do they have 250 extra hospital beds in Dougherty County? Do they have 250? That's the people who are going to the hospital, guys. Do they have an extra 250 ventilators, respirators? Do they have an extra 250 staff to help them out? So instead of those people getting treated, they're going to die if there's not enough room. Let's see if I got anything else to show you. I don't know. And guys, let me show you Dougherty County. The reason Dougherty County is so bad is look at this data right here. All right, you can see right here, they are second in the state, but there's 1, 2, Fulton, DeKalb, Cobb, Gwinnett, 3. I don't know what that one is. I got to get myself out of the way. Bartow, Cherokee, Lee, Henry, Floyd, Coweta, Fayette, Lowndes. All right, Gordon. Like all these counties had a head start. Why is Dougherty County exploding? Let me tell you why, guys. Because it's I don't need to worry about COVID-19. I'll be all right. I'm going to go to the barbecue, whatever. I need to live my life. Look, I'm telling you guys, when people are dying outside of the hospital, it's because you wanted to go live your life. I want to go on my spring break. I want to do this, that. And this is just the way it is. Don't be a vector. Don't be somebody out there transmitting the disease. I hate to be all sobering and mean and stuff like that, but that's just the way it is. And one last thing. Let's look at the bad model for China. Okay, China is a bad model because they put down some really draconian rules. Nobody could go anywhere, and that's just not how America is. Okay, I mean, we're all about freedom. But here you need to understand the confirmed new cases tells a story. To confirm the new cases has to go down before the total cases even starts to peak, about 2 weeks. Okay, so and by total cases, I mean this is under treatment, daily treatment. Okay, the orange curve. That's the load on the hospitals. So the confirmed cases in Georgia, new per day, has to peak and come down. And then you have 2 weeks of even more spike of people under treatment, the orange curve, because we're right here. I mean, this is the only data we have to go off. I could look at Italy and all that, but I'm pretty sure they show the same statistics. And if you think of China as locking them down as hitting that max population, even though they didn't even come close to hitting the max population, the lockdown created a situation where their max population was diminished hugely because of the lockdown situation. So this data is relevant. So you got to get confirmed cases to peak and go down. Well, look at where we're at, guys. All right, Georgia as a whole. Our the red line, new cases per day. That's new cases per day, guys. It's still going exponential. So what that means is we're not even going back down yet. So we're still going to see exponential growth. So in all your counties, if you're getting 100 cases per day, or let's say, and all these people are still in the hospital, guys, the 25% that I'm talking about, they're all still in the hospital. So let's look at the numbers right here. Fulton County, 300 people. All right, easy math. 25% of that is 75. 75 people in the hospital. If there's 400 people tomorrow, there will be 400 people in the hospital. Now, as time goes on, it takes about 20 days to recover. This recovered column will start going up, but it won't matter if the people in the getting it column are still exponential. And guys, they will be. It's going to be exponential. It's going to continue to be exponential. We got to try to flatten the curve, okay? And how much exponential it is depends on whether or not you're trying to stay at home and trying to do the right thing. My wife's a nurse. Don't want to see her be in a situation where her hospital is taking patients. They're not taking patients because there's too many people in the hospital. So do yourself a favor, do the rest of the world a favor, and stay home. Peace out.